Malaria is currently the leading cause of illness in Ugandan children. Though it is a preventable disease, it's responsible for nearly half of all childhood deaths. But things are changing. The government of Uganda is committed to achieving universal coverage of long-lasting insecticide-treated nets. The Ministry of Finance became the principal recipient of a Global Fund grant that would help the government procure and distribute more than 17 million bed nets. The initial procurement of 7.2 million are enough to cover nearly half the population. By pooling the procurement process, the mechanism helps Global Fund countries like Uganda resolve procurement bottlenecks and supply chain management challenges. It also helps them secure timely access to health products. 3.4 million of the 7.2 million nets procured through the VPP have arrived in Kampala, and the remaining nets are already on their way. Moses Odongo is a fleet and logistics manager with PACE, PSI's affiliate organisation in Uganda. As the selected procurement agent for the VPP, Moses and his team are on site to ensure that the nets arrive safely and are stored securely. Cosmas Elotu is a program manager at SPDAG, a local logistics company that is helping PSI through its contractor, Green Shields Cowie. With 50 people on the team, PSI and its partners will be able to offload 14 containers each day. To authorise the distribution, PSI works with the Ministry of Health, the Uganda National Business Standards and the National Drug Authority. Once authorisation is given, the packages, each containing 50 long-lasting insecticide-treated mosquito nets, will be ready for distribution. Less than a week after the nets arrive, warehouse clerks are busy organising the logistics behind the distribution of the nets. Teams of 10 run swiftly between the warehouse and 27 7-ton trucks waiting outside. Filled, each truck can carry 11,000 mosquito nets. 19-year-old Fred Sewankambo is one of 60 drivers hired by SPDAG and supervised by PACE. He and his colleagues will move the nets out to more than 700 sub-counties in Uganda throughout this distribution. In the sub-counties, communities are gathering and people are excited. Bagalia Madina is a village health team member in Busagazi East Village. She and her colleagues are helping distribute the nets. Each person receiving a net signs for it with a fingerprint. These nets are being distributed to those most at risk of the disease, pregnant women and children under 5. Overall, more than 14 million people will be protected by the 7.2 million nets procured by Uganda through the VPP mechanism. But the nets are providing much more than protection. They're providing mothers with the hope that their children will grow up to lead happy, healthy lives.